Hello everyone, this is Adam Stewart from stewartmedicine.com. I'm just going to show you some tools that I built to help with opioid prescriptions and renewing them and telling easily when they're coming due. As well, I'll show you later on in this how these features can be used for groups of physicians who, when a physician is going on holidays, may pull a list of their people who are on opioids and can update their prescriptions before they leave on vacation. So the EMR has a preference that many people might not have turned on, but it's a very useful preference to go into the settings and turn on the end date so that it shows in the medication list up here. And for regular medications that are prescribed, for 90 days or 100 days and so forth, the EMR does a great job of telling us when that prescription is falling due. But opioids are a little bit different for a few reasons. For one, they're often prescribed as PRN, and it's challenging for the prescription writer to figure out the due date from there. As well, I usually try to keep a very tight control and tight calculations of my opioid prescriptions. So if a person is not due from 10 days from now, I might not prescribe it from 10 days from now. Or if I'm going to renew early, I will still be calculating their next due date based on 10 days from now, not today's date. So if you write an opioid prescription in the prescription writer, the EMR will calculate it from today's date, the date that you're actually prescribing the prescription. You could post-date the prescription technically, and then the EMR would do a little bit better job of calculating the duration from there. But then you've also got to add on the annotation to the prescription that it's okay to release now. So for a lot of these reasons, and it'll become a little more clear, I'm going to show you how this might work with the tools that I built. So let's say this is a fake patient chart, and let's say that we're going to prescribe the patient some hydromorphone. Actually, let's just make this a little bit more practical. Let's just say that the patient is going to be prescribed some Dilaudid, and I'm just gonna keep this simple. It's a fake patient, so it doesn't actually have the driver's chart, but let's just say you have 1 tablet PO, Q 4-hour PRN. Let's say for some reason we want this, we know that we want them averaging no more than, say, 2 a day. We've discussed that with them, so no more than 2 per day. And we're going to give 20 tablets. Okay, so in this case, our next prescription, so I'll just post that to the chart. So if we're giving 20 tablets at 2 a day, then the next day prescription will be due in 10 days from now. Now what's happened is this is the first time this patient has ever had prescription for opioids, and what you'll see, a toolbar has popped up down here now, and it has it's not completed. I'll show you. It's going to bring in some dates for us in a second here, but this toolbar has popped up to come up whenever there is a prescription for an opioid in the medication list. So right here, there's a button right here for a prescription custom form, and if I click that, this is the first time we're ever prescribing this opioid for this patient, so it doesn't have a due date because this is the first prescription. But so what I would do here on this first prescription is I would enter it in. Now let's pretend, let's go back in time for the sake of demonstration here, and let's change this to June the 1st. So we wouldn't do this in our daily practice, but just for the sake of demonstration, let's pretend that we did this prescription on June the 1st. And so we would know that it would be coming, the next due would be June 11th. So the actual custom form is formatted so that the date, regardless of what way you enter the date in, it's going to format into this. So let's say, and I guess I forgot to enter this part. We are going to prescribe it effective the June the 1st, and it's going to be for it. I've defaulted it to 12 weeks because that's what my normal prescriptions are. But in this case, I'm going to prescribe the duration is 10 days, and the next due date is calculated from, well, both the due date and today. So I'm going to click that. I've left a little box here for some custom notes that people might need to make from time to time. So now, let's say it's actually 10 days later, June, or actually, so what happens here is if I check this chart out and refresh the chart, you'll see that it's actually bringing in this toolbar now, next due June 11th, right there. And then, so if the patient comes in today and we're going to need to prescribe it again, let's say we could do, let's say today is actually the June 11th, they're coming in today. So we're going to renew the prescription. And we might say, okay, well, they're doing good on this, so I'm going to give them 60 days worth. So we're going to give 120 tablets. I usually wouldn't give that many in one prescription, but let's just say for this sake, 20 tablets is going to last 60 days from today, and we will post that to the chart. So if we click on this again, it brings in a fresh custom form here on today's date. It's saying, it's already telling us the due date, the next time it's due is June 11th. The renewal is, we're going to write that effective today, today's date, and we're going to make it for actually 60 days, calculated from the due date, or today is the same date. So what I usually do is go over to my appointment calendar, and if I just type in 60 days, it would tell me exactly that is August the 22nd. August 22nd. So now, when the chart is refreshed, you'll see that this comes up here. There's a few other features in this toolbar that I've put in, and I might evolve this toolbar as I go, but here's a filter that just shows these opioid custom forms. So filter RX custom forms. So that way it gives us a prescription history. We can see all of them that have been used before. I guess this was an old one I was trying it before, but we can see it just at a glance, all the prescriptions of opioid prescriptions. That's useful. The other thing is that an opioid risk tool. So I think this would be especially useful if you were covering another person's patient and you wanted to know what their opioid risk tool was. Here's a button that actually, so it's saying never done because it's never actually been calculated for this patient. But so that's kind of a reminder too that for people to be doing the opioid risk tools if they're prescribe if they're going to be prescribing opioids. So I mean, you can. I built an encounter system that quickly calculates this for me. Let's just say all that. So in this case, the person's range would be moderate risk, but their opioid risk is 7. Now, the vital, it's right there at ORT is the vital I've used in my EMR to document that as a custom vital. But notice now if I refresh the chart again, what's going to happen is right there. It's going to show forever now in this patient. It will show at a glance what the opioid risk tool is. So that's kind of a neat way of just telling when prescriptions for opioids are due. I think where it gets really neat now is that in this case, let's say I'm going on vacation and I want to search which of my patients are going to be coming in. Let's say I'm going on vacation in August. Let's say I'm taking a couple of weeks off in August. So I can go into my EMR and I can pull a search that I've built called, if I say vacation opioid prescriptions. And you see the way the search actually works is that it's giving us a date range, 2 lines that actually give us a date range that are looking for the next due date, either earlier or later than or earlier than the next due date. And where that box is actually looking is right here, this due date here. So because the whole custom form is properly formatted, or formatted in a date format, I'm just going to search this patient's other doctor in the EMR. So if I pull a search for other doctor, and I'm going to search, now I've got it set to actually customize, ask you the date, the range you want, so the date you're leaving. So let's say I'm leaving August the 10th, but you want to leave at least a couple days earlier than that. Like if you're going to be renewing prescriptions, maybe if I'm leaving on August 10th, I might say I want to know who's falling due between August the 5th and let's say I'm returning September the 1st. But let's just say add another buffer there. So let's just add September the 5th. So that I want to know all the patients that are kind of becoming due for opioids between those dates, and it will pull this search. In this case, this is me just starting to use this, so it's showing me, it's bringing up this patient because in the date range that I gave, this date range falls in there. So I can then run this list, renew my patient's prescriptions. One thing to get started on this, you might have also noticed I made a search. From time to time, people might want to run a search or is to see who maybe is on an opioid prescription but hasn't been using this custom form. It's not really cleaned up. So this is what I call a vacation opioid cleanup search. And what that does is, you'll see in a second here, it searches for patients who are on any opioid, and that the date, either that this form, the opioid renewal custom form down here, has never been used, or that the next due date is actually it's a little bit confusing the way it's set up, but earlier than 1 day from now. So basically, any day from today or in the past. So that's a neat little search you can use to clean up the search. Hope you found that useful. Thank you for watching.